I am Professor Dr. Vivek Gaur. I am a maxillofacial surgeon and I am practicing in Kaushambi, Delhi NCR. My clinic name is Simpler Dent Clinic, and this clinic is specialized for doing a corticobasal implants. Corticobasal implants means immediate function loading implantology, and we practice and we operate and we do the Simpler Dent implants. They are the pioneers in immediate loading. They are the first in the immediate loading, and they are from Switzerland. Guys, now you go to a dentist and he tell you after reading the OPG or the scans that in the back I have to do one procedure that is called a sinus lift. It is going to cost a bit more. I'm going to put some powder material also, some graft materials, and then actually after waiting for 4 to 6 months, then I'm going to put a cap or the teeth actually over the implant, and that procedure is called sinus lift. So he explains you like that, it's the utmost necessary step is there, and without that you are not going to survive. No, it's not like that. In my convention days from 2003 to 2009, I did multiple sinus lifts actually, okay. That's why I have an authority to explain the thing, because I have gone all through phases. Now, when you have a bone is available less in the sinus area, there's an empty cavity is there in the upper jaw, till 7 to 8 mm, you do a sinus lift, yes, it is successful because the bone is available. But when your bone is available less than 5 mm, do understand it's a very questionable prognosis there of a sinus lift procedure. And when we put a graft material in the sinus, to understand the sinus membrane, that is also called Schneider membrane, it really overreact with this coarse graft material, the powder material, and very high chances there a patient can go for the sinusitis, okay, a chronic, a prolonged sinusitis. So is there any procedure? And of course, when you're doing a sinus lift, you cannot do an immediate loading. You have always a much more prolonged delayed loading is there. So is there any procedure is there to avoid the sinus lift? Come on, it is there always. We put a pterygoid implant, we would put the implant in the anterior of the nasal area and we avoid the sinus lift. We are doing from 2010 onwards. So in 2010 onwards, I have never done any sinus lift because my motto is to provide my patient a less expensive, less traumatic procedure following the immediate function loading protocol, and that is called corticobasal implantology.